Hello, this is Dr. Laura Porter, and I'm here to talk to you today about patient advocacy. I'd like to thank the Global Colon Cancer Association for asking me to do this presentation. So I first want to start out with a bit of my journey. At the age of 35, I decided to apply for admission to medical school. At the time, I was working in a lab doing pediatric AIDS research, and I was frustrated with my lack of knowledge. I knew how to do the techniques, but I didn't know the science behind it. In 1997, I started medical school at the age of 37. So this is a picture of me and my lab mates and for anatomy lab. In 2003, I was having severe pain, blood in my stool, and I was anemic. My symptoms were attributed to my schedule and my age. I was working over 100 hours a week uh, because they hadn't instituted the re restrictions yet for residents. Um, and I was 43 years old. I was admitted to the ICU for anemia, low blood pressure, and multiple other symptoms. I was told I didn't need a colonoscopy because of my young age and lack of family history. This photo was taken shortly before my diagnosis. I was discharged after 5 days and I was told to take iron. I was getting worse and went to a different hospital August 25th in 2003. I took my stool with me in a container to prove that I was bleeding. I had been seen in the ER and by my primary care doctor, and they all told me that I wasn't bleeding. So within 20 minutes of being examined, I was admitted. By September 1st, 2003, I was diagnosed with stage 4 colon cancer, and my journey began. I had two recurrences. The first in my liver and ovary, and that was in 2004 or 5. I transferred my care to Johns Hopkins. I was going to a small community clinic, and I wasn't happy with the care that I was receiving. Um, I delayed going to Hopkins because I just did not want to tell my story again. I just did not want to go through everything. But it was probably the best decision I made. The second recurrence was in 2005, 6. It was in my pancreas and all my abdominal aortic lymph nodes. I had multiple rounds of chemotherapy, multiple surgeries, and targeted therapy, which was Avastin, along with many complications. If there's a complication, I had it. And luckily and thankfully, I've been no evidence of disease since May of 2006. So now I want to talk about my advocacy journey. I have been active in the advocacy space since 2005, mostly with the Colon Cancer Alliance. I represented them on a number of different levels for over 12 years. I am active with ASCO, the American Society of Clinical Oncology. I am on 5 different projects with them, including a guideline panel and um, prevention, cancer prevention uh, group. I am also active with the FDA. I'm on the NCI, Rectal Anal Task Force, National Quality Forum. I'm on 2 panels with them, geriatrics and palliative care, and the technical expert panel for opioids. I do grant reviews. I did them in the past for the Department of Defense. I currently do them with Conquer Cancer and with CPRIT, Cancer Prevention and Research Institute of Texas. We meet twice a year. So I have spoken at national and international meetings, written patient-friendly web content, one-pagers, and webinars, and I'm currently working on setting up the website for our new project. My advocacy work has prepared me for the work I was meant to do which is co-investigator on the CRUK Optimistic Grant. So I want to just briefly talk about CRUK. That's Cancer Research, United Kingdom. Their vision is to bring forward the day when all cancers are cured. They have the Grand Challenge, which is a huge opportunity for researchers. It's a series of £20 million awards over 5 years, given to teams willing to take on the toughest challenges in cancers. These awards give teams the freedom to try new approaches and also at a scale that is not possible with other funding routes. The first round was in 2017. They had 57 applications. 9 teams were shortlisted and 4 teams were funded. The second round was in 2019. They had 134 applications, 10 teams shortlisted, and 3 teams funded. When I was approached by one of the co-investigators, one of the co-PIs for the grant, he said we have a 4% chance of receiving the award, and we did. So our team name is Optimistic, which stands for Opportunity to Investigate the Microbiome's Impact on Science and Treatment of Colorectal Cancer. Our grand challenge focuses on understanding the microbiota, their impact on the development and treatment, colorectal cancer, and the creation of innovative and effective microbiome targeting therapies. I'm going to go into that just a little bit. So this is our team. Our team consists of people from the United States, from the UK, from Canada, from Spain, and from the Netherlands. You can see all of them, some of the very big names in colon cancer research. And what we do is we have 6 work packages, which will be important when I talk about the advocates. So the first work package is the microbiome and cancer risk. The second one deals with lifestyle components. The third one is the microbiota and the tumor microenvironment. The fourth one is model systems to study the microbiome. 5, interplay between the microbiome and treatments, and microbiome modulation treatments. So recruiting advocates. I was in charge of recruiting advocates to work on the different work packages. That was the initial plan. So this year I recruited 11 advocates from 5 countries. The recruitment and onboarding of the advocate team was the main focus for this first year. I created a webinar introducing the advocates to CRUK and the Optimistic Project with a review of the microbiome and an introduction to the work packages. I also worked with each advocate to create a bio that we could use in our presentation to the CRUK Grand Challenge panel. Each advocate was assigned to a work package, and I also tried to follow up to make sure that they were involved in the meetings. The advocates have brought their expertise and contacts with them, which they have shared, and the reach of the team has expanded because of that. So our advocates, we have 5 who lead or founded advocacy organizations. 1 advocate whose group has outreach in the African American community. Another who is a bilingual navigator with a national advocacy organization. 1 advocate hosts an international podcast. 1 is involved with multiple advocacy organizations, sits on an IRB, and is an advisory position on a few clinical trial boards. Two of the advocates have been trained in the Research Advocate Training and Support, the RATS program, with FIGHT CRC. So we had an in-person team meeting in Boston in October, and that coincided with our CR UK advisory meeting. So the goal of the team meeting was to introduce the advocates and the researchers and have them work together. Most of the researchers had not worked with advocates before, so this was new to them, and they really were unsure of what could be added to their research by advocates, but they were open to it, which was good. Several of the researchers from each work package presented what they were working on. Some of the advocates presented in the mornings before the researchers did. The advocates met with their work, not all the advocates were able to make the meeting, but the advocates who did met with their work package groups, resulting in a feeling of inclusion by the advocates and acknowledgement of the importance of having the advocates at their meeting. So this is Team Optimistic. Everybody looks very happy, and we still are, which is good news. So things have slowed down, unfortunately, a bit because of the coronavirus, but everybody's doing what they can to stay in touch and to keep the work up. So I just want to share a couple of the comments from the researchers about the advocates, and you can enjoy this little cartoon because we all know as patients and advocates that it's true. So one of the researchers said that the advocates have provided invaluable insights into the development of patient-facing materials, which we are now incorporating into the next amendment of the IRB protocol. Another researcher said that they found it hugely impactful to have the advocates present at the meeting, very powerful to have them start the session off by telling their stories. It hammered home the whole point of why we are in this field. From my professional view, they added inspiration to work harder, as well as enhancing the communication of our findings to the general public and patients. And comments from the advocates. These are the advocates who attended the meeting. We were out to dinner in Boston. So I think the best for me, this is a quote from one of the advocates, was feeling like I was involved in something that could possibly change colorectal cancer community in a different way than I have ever done before. Another one said that the meeting was very important in helping me understand all the various work groups and their areas. The material presented was challenging, but by the final day, I felt like I was beginning to process more of it. The enthusiasm shown by all of the speakers was inspiring. It was a pleasure to be among so many experts in their fields. It gives confidence that something positive will come out of the research. So the results, the team meeting turned out to be a fantastic experience for everyone involved, from which we are drawing new ideas for the future. As a result of the meeting, the importance of the advocates and the researchers meeting face-to-face was demonstrated. And this really was the main reason that I wanted all the advocates to be present at the meeting. Because I know that when I have gone to ASCO and sat in on the rectal anal task force meetings or, the other meetings, having them see my face and being involved with me I think it has added to my experience and to their experience with me. The advocates have brought their expertise and contacts with them, which they have shared with the group, and it has ended up expanding the reach of the team. And although we have assigned the advocates to work packages, we are flexible in where they may want to contribute. We are working with the advocates to determine where they may fit based on their skills and interests. For example, developing the website content and other educational materials. Like I said, we are working on a website, and we're going to have a back portion for the team, and we're going to have a public and patient facing portion for public and patients, which will include a glossary, lay summaries of all of the work packages, and any of the current clinical trials that are being done with the call out for people to be involved. So, successful advocacy. I really like this quote: unless someone like you cares a whole awful lot, nothing is going to get better. It's not. And that's the truth. So, my suggestions for successful advocacy: recruit advocates of variable background and disease status. So, not everyone needs to be highly trained. It's good to have people that are trained, but I think that it's also important to have people that are new to the advocacy space, because they bring a new, fresh perspective. And also, if you're working on developing information for the patients and public, if you have highly trained advocates, a lot of them already know this stuff. So if you get newer advocates involved, then you can run some of the possibly more complicated items by them. So have in-person meetings with the researchers and the advocates. I cannot stress this enough. And we had to get special permission to shift our funding around so that we could have the advocates attend the October meeting. And then when we went in January to London, or February to London, one of the advocates went with me and the group, and it was incredibly beneficial. And it's also extremely important to compensate them when possible. We were having a little problem. A couple of people weren't responding to emails, but when they found out that they were going to be compensated, now everybody shows up. It's kind of funny what a little financial incentive will do. Facilitate the team structure in all settings. So no matter whether it's on a call or whether it's presentation, in person, that it's so important to maintain that we are a complete team, that it's not advocates, scientists, physicians, et cetera, et cetera. It's just a team. And I have to say that I'm extremely impressed with the researchers and the scientists on our optimistic team, and how quickly they embraced the advocates. And also encourage participation and asking questions. Encourage them to ask questions. One of the things we learned from this year's meeting in Boston is that we need to set aside a little time for the advocates to ask questions when they are, confused, like after a presentation. So, and then, and also, I mean, they felt comfortable giving their opinions when asked, which was very important. And we are looking forward to another exciting and productive year. And I want to thank all of you for listening. And if you have questions, I'm sure that Global Colon Cancer Association will be able to get you the information to be in contact. Thank you again, and enjoy the meeting.